Hi, I'm Shane Bayless, Doc Hockey for Pro Oregon Sports Injury Clinic. We're going to be talking about low back pain, usually chronic low back pain, that we want to use core stabilization with movements of the upper or lower limbs. So we're going to do lower trunk exercises, and this one is a 2 knee to chest with 4 to 6 inch lifts, usually like leg lifts.
Key here is that you want to have stabilization through the core. So usually we do like a pelvic tilt, so we're flattening the back into the bed, and we're holding that kind of contraction. Okay? Be in a comfortable position. You can put your hands on the sides or on your stomach, either way. So what we're going to do is just be lifting the leg up about 4 to 6 inches, nice and slow. Hold for about 2 seconds all the way down, and just touch, back up, 4 to 6 inches all the way down, and I'm holding that core contraction. That's the biggest thing. It doesn't move. The hips don't move. It's just the legs that are moving. Okay? We're going to do that for about 20 reps. Right? We do it at least once a day, especially if it's combined with other exercises. All right? So remember, pelvic tilt, brace all the way up, 4 to 6 inches all the way down, nice and slow, all the way up and all the way down. Now to increase this a little bit, you can do it with both knees up about 4 to 6 inches, as long as you can stabilize that lower back so it's not moving and that core contraction the whole time. All the way up and all the way down, 4 to 6 inches.
So that's the exercise of the 2 knee to chest with 4 to 6 inch lift. And we're going to do that, remember, 20 times. We're going to do 2 sets and 1 time per day, especially if it's combined with other exercises. If it's not, then you might want to do it at least twice a day, like morning and night. So I hope that's good information for you. Take care. Hi, we're back for our lower trunk stability exercises for chronic low back pain. We'll be showing the heel slide. So about 4 to 10 inches, you'll be sliding the heels towards the butt and then maintaining a core pelvic stability. All right,
and here we're having the heel slide, and we're doing it on the bed. You can do it on any flat surface. So as we're going here, we're making that pelvic tilt. So usually I like to flatten the back against the table or the floor. Make sure it's not painful. It shouldn't be painful. And as you're kind of pushing and bracing with the core here, then we're going to be sliding the heel all the way kind of towards your butt, about 4 to 10 inches. And then we'll bring it back and then in through the other side as well, 4 to 10 inches as well. All right, make sure we're not rotating the pelvis each way, because that'll decrease the stability, and that's not what we want to be doing when we're doing exercise from a running to a swimming to anything that we want to do functionally. All right, excellent.
So just to go over, we're doing the heel slide 4 to 10 inches in the transverse plane stability. So in the transverse plane stability, reps 20 times, sets 2. Hi, we're here with a third exercise for our lower trunk stabilization. It's called hip external or outward rotation with a pillow. This is to help with stability of the transverse plane. Now I'll do the exercise.
Right, with this exercise, we're going to have the pillow underneath the hip, and we're going to have a straight leg, which is the one on the pillow, and the bent knee on the other side. So what we want to make sure that we're doing is that pelvic stabilization or core stabilization. So we're holding it nice and tight, usually like a posterior pelvic tilt, so like flattening the back against the bed or the floor, which is into this pillow here. We're going to rotate the knee outwards, or external rotation, either way, all the way down. You want to make sure that we're keeping the pelvis on the pillow and not moving it as much. And you go down nice and slowly. Bring it all the way back up, nice and slow, keeping that pelvis from rotating. I'm using both my hands here on the tops of my hips, just so I can feel if the hip is actually rotating to the other side, and make sure that it's stabilized. So once again, all the way down, nice and slow, keeping the pelvis stabilized and holding that core, and then bringing it right back up.
Just to summarize what we're doing, this is the hip external rotation with pillow, and we're doing the reps 20 times, 2 sets, and usually 1 time daily, because we're usually doing more than 1 exercise. If you're only doing this exercise, then I would do it multiple times during the day. Hi, this is the 4th exercise in our lower trunk stabilization. This is a lower abdominals knee down and up exercise.
So the lower abdominals knee down and up exercise looks like this. So we bring our legs up. Now remember, it's a knee down and up exercise, so it's the knee, not the foot, that's coming down and up. And we want to make sure we do our pelvis tilt and stabilization. So I'm using my hands to feel for that contraction into the abdominals. And we make sure that pelvis does not rotate or move. All right, so we're stabilizing that. Now we take the one leg and we drop one knee all the way down and we bring it back up, nice and slow, keeping that pelvis nice and tight all the way through there. Down and up, we re-stabilize, going down and up, and we just touch with the heel. We do not rest the heel on the table.
So just to reiterate what we talked about with the exercise, so this is for our lower abdominals, knee down and up. We're doing reps 20 times, 2 sets, 1 time daily. If you're doing multiple exercise, that's fine. If you're doing just that exercise, you might want to think about doing it a couple times a day. Hi, we're here continuing with our lower trunk stabilization exercises. This is the 5th exercise. So the last one of this series is called lower abdominals with leg lower, and I'll get to the exercise.
We want to make sure we find that neutral pelvis position though. So we're basically going upwards and downwards, finding it where it feels comfortable, and then usually it's a little bit more where we're flattening the back against the floor or the bed or whatever surface that you're on. You want to keep that nice and tight so you can use your hands again on your hips to feel that kind of contraction that's being maintained. And we're going to be lifting the legs up, all right? We're going to be extending one leg outwards all the way down, nice and slow, until it hits the floor, and then you're going to be bringing it back up to the starting position. Usually we're going to be starting with that one leg, and we do that about 20 times, and then we reverse to the other leg. Now when you become really good at this exercise, you can alternate each leg and do, working up from 10 reps each side to about 20 reps each side, so that you can maintain a stability with an increased endurance since you're doing it for a longer period of time. So just to show it with the other leg, we have both of our legs up, we extend it down, keeping that pelvis in that neutral position, holding that tight core all the way in, all the way back up, all the way down, all the way back.
Just to summarize, with the leg lower exercise, we're doing 20 reps, 2 sets, 1 time daily. And remember, if you're doing more than 1 exercise, the 1 time daily should be fine. If this is the only exercise you're really doing, I would do it multiple times during the day. Have a great day.